take an ego-driven military guy who's trained one way and try to make him mindful. It's very difficult. It takes a lot of practice. Cannabis helps with that practice. There's no prescription drug that I've taken, that I'm sure Chris have taken, that has helped us be mindful. Like Andrew said, it turns us into zombies. Causes erectile dysfunction, makes you gain weight, can't get off the couch, can't have sex with your spouse. What kind of life is that? They wonder why the divorce rate's so high.
If we are going to be an evidence-based community, that we should certainly look at the evidence for medicinal marijuana, and we should use marijuana where the evidence says that we should, and we should not use marijuana where the evidence says that we shouldn't. The current data does not suggest that pharmacotherapy is effective for treating veterans for PTSD, but we do have good quality evidence that a lot of veterans do very well with cannabis use.
So a client, Andrew, came into Marijuana for Trauma a few months back with shaking so bad he couldn't hold a cup of coffee. I arranged for Andrew to try cannabis called Avidecal, which is a CBD dominant strain that does not get you high. I could not use CBD and get relief. Andrew, however, vaporized 1 gram of cannabidiol, and in 3 minutes went from violently shaking to completely stopped and able to have a complete conversation. And when I seen that with my own eyes, so many things were going on in my head that people need to see this. People can't think that cannabis has no value, no medicine, no place in the medical world. It does. Even if it's only for Andrew, and he uses a different cannabinoid, and he doesn't get high. Soldiers aren't out there just getting high. We're feeling normal.
Come in here, we're also assigned a cannabis coach, and the recommendation is to vaporize the marijuana, and oftentimes patients use something like this. It's about $300, and Veterans Affairs Canada covers $300 every 3 years.
When you're looking for medical or mental health treatment, there are lots of choices and lots of claims about what works. There's advice from friends and family, news headlines, and the internet. The truth is, not all treatments work equally well. So how do you know what's best? Evidence-based treatments give you the best chance for recovery. There are different perspectives on exactly what it takes for a treatment to be considered evidence-based. In general, the scientific community looks at 3 things: the number of research studies, the quality of those studies, and whether experts agree the treatment works. Let's learn more. Evidence-based treatments have been tested in multiple research studies. One study isn't enough to really know whether a treatment works. Our confidence grows when studies are repeated and researchers find the same outcome. This is especially true when treatments have been studied by different researchers in different settings, all with similar results. The quality of those studies is important too. In high-quality studies, the people in the study are the kind of people who would use the treatment being tested. In addition, the treatment being tested is compared to another treatment or to no treatment. And participants are randomly assigned, by chance, to the treatment groups. That way, we know the groups are the same at the start and that improvement during the study is due to the treatment. Another characteristic of evidence-based treatments is expert agreement that they work. If a study is published in a scientific journal, it means reviewers examined how the study was done and agree with the conclusions. There are also organizations, like the Institute of Medicine, American Psychiatric Association, and Department of Veterans Affairs, that review studies and publish recommendations identifying evidence-based treatments. The stronger the recommendation that a treatment is effective, the more confidence you can have that the treatment has good outcomes. So, when you're searching for a treatment, look for the term evidence-based. When your medical or mental health care provider offers a treatment, ask about the research that supports it. If the treatment isn't evidence-based, ask why it's being recommended. For most people, evidence-based treatments offer the best chance for recovery. For information about evidence-based psychotherapy and medication for post-traumatic stress disorder, or PTSD, Visit the National Center for PTSD website at www.ptsd.va.gov. Have you or someone you love ever been in a tornado or car accident, experienced sexual or physical abuse, served in a war zone? Most people have been through some kind of life-threatening or traumatic event, and it's common to have stress-related reactions after a trauma. But when symptoms last more than 3 months and they're not getting better, it's time to get help. Meet Sam. He recently returned from serving in Iraq. For many people, being in a crowded place like a baseball stadium or busy grocery store feels comfortable, but not for Sam. What should be a nice night out, taking his wife Tara to a restaurant, isn't fun for him anymore. He can only handle it if he sits with his back to the wall where he has a good view of the exits, and even then, he's too on edge to really enjoy it. At home, things aren't the way they used to be either. His sleep is restless at best, and some nights Tara isn't sure if Sam comes to bed at all. Sam seems to have a short fuse these days, and sometimes he snaps at Tara over tiny misunderstandings. What he and Tara never talk about is the trauma he experienced when he was deployed. He's never mentioned the guilt, the weight he carries around, wishing he could have done more to prevent what happened. Instead, he's turned inward, pulling away from family and friends. Tara tried to give him some space, but after months passing without change, she really started to worry. She was the one to finally say what they were both thinking: it's time to get help. That's when Sam finally decided to take action. He reached out to a doctor who told him about PTSD, or post-traumatic stress disorder. Sam's symptoms were getting in the way of enjoying his life. Re-experiencing, hyperarousal, feeling worse about yourself or the world, and avoidance are the 4 types of symptoms people with PTSD have. Sam's doctor explained each. The first is reliving the event, or re-experiencing. This is often an unwanted memory or even a flashback where you feel like you're right back in the situation again. Seeing, hearing, or even smelling something that reminds you of the trauma can trigger these. Nightmares where you relive parts of the event in your sleep are common too. The second is avoidance, staying away from situations that remind you of the trauma. That's why Sam tries to avoid thinking about painful memories altogether. He pours himself into his work or uses alcohol to keep his mind from going back to the trauma. The third is feeling worse about yourself or the world since the trauma. You might feel overwhelming guilt like Sam or not trust anyone. You just might not be able to feel happy, even when you are around people you love. The fourth type of symptom is sudden rushes of anger, irritability, feeling jittery, always on alert, always on the lookout for danger. This is called hyperarousal, and loud noises or a driver cutting in front of you can be all it takes to set you off. If you recognize any of these symptoms of PTSD in yourself or someone you love, don't wait. See your doctor to find out if it could be PTSD. Just like Sam and Tara found, there is hope. You don't have to live with the symptoms of PTSD forever. Effective treatments are available. To learn more about PTSD or how to get help, visit the National Center for PTSD website at www.ptsd.va.gov.
At Stop Frying Your Brain, our substance abuse advocates and drug addiction treatment experts are here to answer your questions and help you determine your next steps. We're comprised of industry leaders who believe in integrated, outcome-based treatment methods. Our organization is dedicated to treating people, not just addiction. We understand that recovery and rehabilitation does not have a one-size-fits-all solution. The issues and factors that contribute to addictive and compulsive behaviors are as unique as the individuals who seek our guidance. Our programs are developed to focus on the whole person, to find the roots of addiction and substance abuse issues, and not just address the symptoms. Please click on the link below, and we will get right back to you. Thank you.
StopFryingYourBrain.com is a network of substance abuse and addiction recovery experts gathered to act as your research specialist, your preliminary treatment advocate, and your recovery consultant. We are a first step to making the difficult decisions surrounding a personalized plan for drug rehabilitation and addiction therapy. Our services range from maintaining a clearinghouse of educational and crisis management tools to live substance abuse interventions, from intensive inpatient treatment programs to comprehensive long-term outpatient treatment options. Our methods are designed to provide solutions for even the most complicated circumstances. We're here to listen, strategize, and advise. Just click the link below and take the first step today. Thank you.